Welcome to One on One, the Daily Items weekly digital program featuring Susquehanna Valley newsmakers interviewed by Daily Item reporters. Today's guest is new Geisinger CEO Dr. Jaewon Ryu, interviewed by Joe Sylvester.
The Sunbury Motor Company.
Austin Martin, Kia Elite Sales Consultant, Maranatha Christian School.
Amber Wren, Certified Hyundai and Lincoln Sales Consultant, Salinsgrove Bavaria High School.
Ian Chikuski, Certified Ford Sales Professional, Mount Carmel and Shamokin area.
Christopher Stengline, Ford Certified Sales Consultant, Salinsgrove Area High School.
Tom Mertz, fourth generation owner, Sunbury Motor Company, Shikellamy High School.
A tradition of trust since 1915.
Welcome to One on One. I'm Joe Sylvester, and our guest today is Dr. Jaewon Ryu, the new official president and CEO of Geisinger Health System. Welcome, Dr. Ryu.
Thank you so much, Joe.
You were interim president and CEO for about 7 months, I guess. What are your main priorities now that you're permanently in place?
You know, what's been interesting is I don't think our priorities change as an organization. I think we've been doing this for 105 years, where the priorities really been focused around the patient and our health plan members and our community. And I think we still stay laser focused on those things. We've taken a lot of ground and made a lot of progress in many areas, and I'm sure we'll talk about some of them. But we know there's still work to do. And so whether I've been in the interim seat or prior to that in the chief medical officer role or now in the permanent seat as the CEO, I think one thing that I'm proud of and I think our organization is proud of is, it doesn't change what we do day in and day out, and that's making sure that people have access to the absolute best healthcare and, that we're bringing world-class healthcare programs to the masses here in central and northeastern Pennsylvania and even southern New Jersey. And that's what, our 33,000 employees wake up every morning thinking about. And that hasn't changed between November and today.
Is there's something you couldn't do before as interim that you could do now?
I was lucky. I think you're raising a good question. I think a lot of times with transitions in leadership, many organizations, they sort of hit pause on some of the key things. I was lucky to have the support of the team as well as the board and the broader organization. And I think we have folks who really do want to keep advancing and keep advancing the organization and moving the needle on getting better and making health easier. And so a lot of our big initiatives and investment areas, whether it's in primary care or our mail order pharmacy or any of the other programs that we're focused on, we haven't hit pause on those. And during that interim period, we didn't hold off waiting to see what would happen with the search. I think we continue to plow straight ahead because I think our North Star has always been what are the needs of the patient, what are the needs of the community, and certainly those needs haven't changed. And so I think the answer for us still remains the same, which is, well, we have to help address some of those needs that are out there. We have to try to make health easier because we all know we've all been patients or had family members that have been patients, whether it's here or anywhere else in the American healthcare system. Healthcare is complicated, and we need to do our part to make sure we're making it easier.
You had talked about that when you were your first hire, when they made the announcement about you want to improve patient access. How can you do that?
Yeah, and it's not just access. It's literally sometimes
making healthcare easier.
Absolutely, making healthcare easier, and sometimes it's not even healthcare easier. It's making health easier. I'll give you some examples. I think the short answer to your question is I think we can do that by building programs and taking them to patients more often versus historically, we've built these big facilities. They've been state-of-the-art. We've hired fantastic physicians, providers, nurses, and other clinical staff, but we've expected people to come to us to get the care. I think more and more, one of the ways that we're finding we can make health easier is by building the programs and taking it to the people and making it so that we're meeting them where they're at. Some examples of that would be our Geisinger at Home program. We launched that gosh, it's been about a year, and it focuses on the sickest 5% of our patient population, and these are folks that sometimes they have trouble getting to the care, and so we're bringing the care to them. And if you talk to a lot of the clinicians out there, they'll say, wow, I can't believe we're doing that stuff in the home, because even when we were going through medical school maybe 20, 30, 40 years ago, it was unheard of that you would do some of the things that we're able to do today in the home. Administering medications, having point-of-care testing to help us with the evaluation, to fine-tune the care plans. We have that going on where physicians are actually getting back to making house calls. It's not all our physicians, but that team is getting out into the homes. And I think that's a good example of how we can make health easier by bringing the care closer to where we're meeting people where they're at. Another great example is our mail-order pharmacy. We launched it with our own employees about a year and a half ago, and then about 6 months ago, launched it with our own Medicare Advantage Geisinger Gold patients. And this takes chronic maintenance medications, medications that people are on routinely over time, and we're able to deliver it to their doorstep so that they don't have to worry about the hassle of coming in or getting in the car, driving to the neighborhood pharmacy, dealing with refills, this or that. It's just baked in. When we do that, we're able to offer them a copay, a cost share, that's less than half of what they normally pay for these medications. And we know that the compliance rate of these drugs, so meaning how often do the patients actually get the drugs and hopefully take them, we know that that rate is higher by about 35 to 40% at the time. So what that means then is your typical diabetic or your typical person struggling with high blood pressure, they are taking those medications 37% to be exact more often than they do if they have to drive somewhere to go get it or if they have to come into the clinic to get it. That's convenience. That is making health easier, bringing it to them. So those are a couple illustrations. Access, to your point, is another key area. We've been hard at work on that really for the last 3 years since I've been here. The good news on that, we've made tremendous progress. So if you look at our primary care access, 85% of the time now, if you're a patient in our system and you have an urgent issue, meaning you woke up with a fever and the cough and you're not sure if you need antibiotics or not, something like that, we're able to get you in same or next day, 85% of the time. Now for routine physicals, it turns out people don't want to be scheduled right away. They schedule it, my wife schedules it on her birthday so she never forgets. But those kinds of things you could plan further out. But for the urgent visits in primary care, we've made a lot of progress. On the specialty care side, and we track how we're doing on access, for about half the specialties, we're now faster in getting people in to be seen than if they were trying to go somewhere else in the community outside of Geisinger. And the trend lines are improving as well, so we think we'll continue to improve there as well. It's truly taken a village. I mean, it's taken efforts from the technology team, from each of the provider teams, a lot of process rebooting, but we're finally glad to report that progress is there. Now, we still have challenging areas, and part of it is you got to recruit, and there are some places where, I'll give you some examples. Turns out dermatologists don't grow on trees. And when I used to live in California and in a former life, in a former job, I traveled down south quite a bit. And going to those markets, sometimes you actually thought dermatologists did grow on trees. But here it turns out they don't. And so we still have some specialties where we're actively recruiting and making sure that we have the right number of people to provide the access. So when we're talking about access, it's a lot of different things. It's the people, it's the processes, it's the technology, but we have made progress.
Speaking of that, there's still a long wait time for a lot of appointments for specialties. We've had people tell us that they waited months and their appointment was postponed so that it was months later. That's probably a complex answer too. Is it a shortage of doctors? Does that still exist?
I think it's a combination. It depends on the specialty. I mean, each one is a slightly different story. And I think the good news is, again, we've made a lot of progress there. And it's also where in more than half the specialties now, remember, we're actually faster than what it would be to try to go somewhere else. So some of it is a function of just where we are here in rural Pennsylvania. It's probably not as easy as if you were, in Los Angeles or something, and there's an abundance of all different kinds of specialties. But that being said, we've had a lot of great progress even on the recruiting front. We see the numbers as we credential new physicians coming into our system. And over the last 2 years or so, we've had a winning streak of more folks coming in than going out. And it's not even a subtle amount. So I think we've hired, and we can get you the exact numbers, but it's hundreds of new physicians over that time frame. And so we think we're in a better spot there. And then there's been a lot of process work and so forth. It really does depend on which specialty and which location. Especially, we have some specialties where we're covering across pretty wide geographies. And if a patient says, well, I only want to come to this location, then yes, the wait is a little longer versus if they're open to coming here versus going somewhere, Wilkes-Barre or Hazleton or wherever, somewhere else, those wait times tend to be shorter. So I think that there are a lot of factors at play, but those are the things we juggle.
It's not just hiring more doctors, it's doing other things.
Oh, there's a lot. Yeah, I mean, it's as you say, it's there's a lot that plays into this, but I think hiring more doctors is one key element, and I think that's one that we've worked on quite a bit and made a lot of progress on. So that's a good thing. There's still some areas where we need to continue to keep the pedal on the metal, so to speak, and we're doing that. And then we're also able to meet some needs across our system through things like telemedicine, where now we're actually able to take providers and physicians that are in one location and meet the needs of patients that are in another. So we're doing all of those things really to tackle that problem.
We're going to have to take a break for a minute, and we'll be right back.
All right.
The Sunbury Motor Company.
Austin Martin, Kia Elite Sales Consultant, Maranatha Christian School.
Amber Wren, Certified Hyundai and Lincoln Sales Consultant, Selinsgrove Area High School.
Ian Chikuski, Certified Ford Sales Professional, Mount Carmel and Shamokin area.
Christopher Stengline, Ford Certified Sales Consultant, Selinsgrove Area High School.
Tom Mertz, fourth generation owner, Sunbury Motor Company, Shikellamy High School.
A tradition of trust since 1915.
Okay, we're back with Dr. Jaewon Ryu, the president and CEO of Geisinger. We were talking about patient access and appointments. What about as far as the emergency department? Dr. Feinberg, when he was here, wanted one of his goals was a 0 wait time. How is that progressing?
So a lot of progress. Actually, we use a lot of benchmarking information. So it compares us against organizations across the country that look similar to us. And so those are ways that we can, A, map our progress and make sure we're making progress, but B, understand where we stand relative to others that have a similar kind of footprint to what we do, and similar disease burden to what we have in our populations. The other place where we get a lot of information is we end up getting information from outsiders that come in and help us on projects, whether it's related to facilities or others. I lead in with all that because what's been interesting to find out is that the wait times here are actually, among the industry, were better than the norm, believe it or not. And so I think that's reassuring, but we know there's still a lot more we can do. And we are going to keep driving towards 0. Now, if you look at some graphs that we track about how are we doing, have we made progress, starting in 2015, since we really started working on this effort, the average wait time in our ERs across our system has steadily gone down. And I think now is where we're finally able to say we're actually better than the norm of what's across the industry. Now, let me caveat that what's across the industry is still decent amount of weight in every ER across the country. And so we know that there's still more we can do. Part of it is space, and so we're looking at how we can revamp the space. Some of the external folks that have come in and helped us and helped evaluate our space needs have actually told us that a couple of our ERs have seen the greatest, they're the busiest per square foot that they've seen ever in their history of doing this. So that's what we're up against. Now, even with all those challenges, though, there's still more we can do. And so our jobs and what we tell our teams is that we want to continue to see the trend lines go down, meaning shorter and shorter waits. And at this point, other than a couple high volume times during the week, like a Monday morning, for example, we do have a good number of the time where you come in and the waits are pretty close to zero, meaning you're going to get seen by a physician in a pretty quick way. Now, after you get seen, the testing, the imaging, and then you may or may not need some consultants that come in and weigh in on what the appropriate care plan is for you. That will always take time. There's no such thing as a zero on that, because that means we didn't see you, we didn't test you, we didn't evaluate you. But if we can just shorten the amount of time it takes for you to see a provider, and then shorten the amount of time for all those subsequent things to happen, we know that we're firing on all cylinders, and we're getting a lot better on that.
What are some of the ways you can get patients seen faster?
So what we started to do is actually put a provider out into triage, especially at the busier 12 hours of every day. We actually have a provider that screens who's in the waiting room and things that we think we can take care of without even doing any tests. Some of the minor things we do straight out of the waiting room. And so that's helped to improve the flow. We've also done a lot on the hospital flow side. Believe it or not, when the upstairs gets jam-packed, it's tough with the downstairs in the ER because there's nowhere to put those patients if they need to be admitted. So it has a tendency to then sort of back everything up and things clog up. I'm a little biased as an ER physician. I know that dynamic well. And a lot of people point to the ER, but it's actually got to be an overall solution, not just in the ER, but also in the hospital, so that people who are getting discharged are able to get discharged earlier in the day before the volume really starts to pick up in the ED, so that the beds are turning over and there are places for them to go if they need to stay, and that helps to continue the flow through the ER as well.
Also, I want to ask about if there's still a shortage of nurses.
So nationwide,
is that still a problem?
It's a problem everywhere in this country. And I can't go a couple days without reading an article that comes by my desk about the nursing shortage in this country. I think this is another area where we still have miles to go before we sleep, but wow, the progress has been phenomenal. And this is also at a time, remember, where we're launching new programs that put even more demand on the need for more nurses. So our Geisinger at Home program that I mentioned earlier is a great example of where we've had to hire a whole lot more nurses that we didn't need to hire before that program. So we're constantly creating more need because we're building programs. These programs are exactly the right things to do to make health easier, but that means there's even more of a need for nursing. And so what we've done is we've had a long history of partnering with educational programs, whether it's Bloomsburg University, Wilkes University. I mean, there's a lot of educational institutions that we partner with very closely, where we serve as the teaching site for a lot of those nursing students, and that helps to give them a taste of what we do, and many of them like what we do and choose to stay with us after their graduation. So that's one way we bolster our pipeline. Another thing we do, we've launched our international nursing program, where we know that Ireland and Philippines, for example, a lot of highly skilled nurses that others across the country are able to tap into those areas to get a steady nursing stream. And we've started to do that, and it's been wildly successful. Highly trained nurses coming in from elsewhere in the world, and they've really been welcomed in our communities and in our hospitals and care sites. So that's been phenomenal. The other thing that we've been trying to do is sort of leverage some of our advantages. Geisinger is not just a hospital system. In fact, first and foremost, I think it's a healthcare delivery system, which houses hospitals, but also employed physicians, clinical staff, a health plan, a health insurance company, a medical school now, research institute, genomics institute, innovation institute. There's so many great things that make Geisinger special. And so we've been trying to capitalize on all those things because people who want a little bit of a variety in their careers, maybe it's a nurse that wants to do 2/3 of her time at the bedside, but wants to start learning about the business aspects or the payment aspects of healthcare, or wants to get more involved in the teaching aspects at the medical school, or wants to become more of a tech IT innovator. We have those avenues for those people to come and pursue those interests, and we're developing more of a formalized curriculum or more of a formalized track that they can slot into for things like that. And that's not unique to nursing. We're doing that for physicians. We're doing that for residents, resident physicians who come train with us. I think that's going to be the answer. Some of the terms that we've been describing or using to describe this phenomenon, we want to be that talent factory, so to speak, so that we're leveraging all of our strengths and creating opportunities for people to have a broad swath of opportunities beyond, just this or that.
Oh, speaking of healthcare, where do you see that going? Are there any health plans proposed by any candidates that would?
Your guess is as good as mine, Joe. What I would say is, and believe it or not, and I don't know how many folks are aware of this, but I started my non-clinical career in government, working on healthcare policy. And I worked at CMS, the Centers for Medicare and Medicaid Services, and that's where the Medicare and Medicaid programs are administered. And what was interesting to me is different plans and different proposals kind of come and go, and it's almost like the things that make for success across all of those different options always tends to be the same thing. And if you just stay focused on those things, I think regardless of which way the political winds blow or which way the proposals happen to kind of flesh themselves out, we'll be pretty well positioned, and more importantly, our community will be well positioned. I think those things that are core are always where can you drive value? Where can you make health easier to try to keep people healthier and to try to keep care more affordable? And if you're doing those things where you're driving health outcomes and doing it in an affordable way to make it sustainable and make it an asset for the communities that you serve, I think no matter what the policy, no matter what the plan or proposal that's out there, that strategy will always win.
Just say a quick question. Is there a point where you think Geisinger could get too big, be too spread out too far, or?
I don't think so. And it's almost, I could see that one cut both ways, to be totally honest. Mm-hmm. But if you look at healthcare today in this country, a lot of our competition is not who people are used to thinking is our competition. Our competition is probably not some hospital system. Nowadays, healthcare is sort of an industry where other really large companies are entering. So a lot of mergers out there, whether it's Aetna and CVS merging together. CVS was a retail pharmacy shop traditionally. Now they're a health insurer and also a deliverer of care. That's a very big company. So if you compare the $7 or $8 billion or whatever Geisinger is against the 140 or 150 billion dollars that CVS and Aetna might be, don't quote me on the numbers, but you get the idea. or United Healthcare and all of its Optum subsidiaries, probably in the $250 billion range. That's competition. And so could you ask, well, are we too big? I think most people would say against those kinds of dynamics, no, we're not too big at all. In fact, when you're purchasing drugs, when you're purchasing equipment, when you're trying to fuel state-of-the-art care, which we're proud to do, those things oftentimes take scale. And that's where size really can be advantageous. So I think it's, that's one half of it. On the other half, and I think this is where you're going, you don't want to lose the coziness. You don't want to lose the personal side of it, because what I would say about all those big companies I talked about earlier, sometimes they get so big that they turn impersonal. And that's something that you always need to be careful about. So I think it's a fine balance between those two dynamics. And, I think we strike the balance decently well, but we have to always do better on that one.
I believe we're out of time.
Great.
Thank you very much, Dr. Ryu.
Thank you so much, Joe.
And you're watching.
Thanks for watching One-on-One. Be sure to tune in next week for another edition.